Hello and welcome back. I'm Ted Gottlieb, Certified Senior Advisor, Seniors Real Estate Specialist, and founder of the Senior Learning Institute. The Senior Learning Institute is all about providing free education and resources to older adults and their advocates. This Senior Learning Institute educational moment once again features occupational therapist Jenny Williams. This is the third of 5 short episodes, and here we're discussing how the occupational therapist evaluates what the patient needs to be more successful at home. Jenny, what are some of the things that an OT's and home valuation is hoping to accomplish?
Well, when we go into the home, we're hoping to see how safely and productively our client is living in the home. So we're looking at what's most important to the client and addressing their concerns to help them stay in their home safely.
Right, because it seems like we all want to come home, but we need to have strategies in place to do that well and to do that safely. So that's great. Why don't you break down for us what the home evaluation process looks like?
Sure. When we go into the home, we are doing usually a room by room walkthrough with the client. So we'll have the client show us around, take a look at the bathroom, the kitchen, how things are set up, if it's set up well, or if there's some things that might need to be changed. And then we look at the client's physical and mental performance. And then if there are any problems found, we suggest different solutions.
Okay, so that's really, really good information, but let's drill down a little bit more. Let's focus on what it is that you're really, really looking for. Where are the typical trouble spots, and help us understand what you're really trying to prevent.
Number one for most older adults once they're discharged from hospital or rehab is preventing a fall. A fall is a disaster. No one wants to have a fall, usually ends back with another hospital visit. So one of the big things to help older people stay at home is fall prevention. So with that, we're doing an environmental evaluation. We're looking to see if there are any unsecured throw rugs, any trip hazards that might be in place, maybe adding some night lighting or a grab bar in the bathroom. So we're doing a really detailed look at the environment as well as a person's physical and mental performance to see what we can do to make them perform safely in the home.
Right. And I also know that having an emergency plan in place as well, and really, really trying to be as proactive as possible. You had mentioned grab bars and things along those lines, because I'm sure that some of these things like throw rugs and things like that, you might be able to roll up and get out of the way. But what about some of the things that need to be installed? And you had mentioned grab bars, and there's also bathroom seat risers and things like that. Do you have crews that do that work for you, or do you refer it out? How do you help to get that all to happen and happen successfully?
Some things are fairly easy. I have helped many people install raised toilet seats or different, low-tech things like that. But if it's something that requires a service of a more skilled professional in construction, I have several people on my list that I can refer out to. So that's something that we're always able to help people find other folks who might be able to help them with those things.
Right. And you want to make sure you do it right. I was just with somebody the other day, and she has a big step into a bathtub, and her major concern was installing grab bars into the wall, and she wanted to use suction cup grab bars. And I said, yeah, in theory, they sound great, but I don't know if they're going to hold your body weight. It really makes sense to do it right and have a professional install it in the wall into a stud so that you know it's going to hold your weight.
I love the suction cup grab bars for trial, though. I mean, it's kind of scary to think about installing things. So sometimes for a week or two, I'll have people work on moving them around and finding just the right place, and then, have this regular grab bars installed. But it is a nice way to kind of play around with it and make sure you've got it right.
You had mentioned not only a home assessment, but a physical assessment. What did you mean by doing a physical assessment while you're there?
Usually, occupational therapists will take a look at a person's upper body strength and range of motion. So, we just ask the client how they can move their arms. We'll do some pushing on the arms to see how strong they are, grip strength testing, and then have them for balance. We usually use what's called a functional reach test. So with occupational therapy, we do a lot of reaching for things. You're reaching in your closet, you're reaching in the kitchen cabinets, you're reaching for the towel. So one of the tests we do to test balance is called a functional reach test, where you have a client stand by the sink or somewhere safe, stretch out their arms, and then we measure how far they can reach. So that's a pretty good indicator of their balance. And if you think about it, it very much relates to your day-to-day activities.
And I'm assuming if you find that there's a deficiency there, then you would contact whom to see if you can get additional support.
Physical therapy. So occupational therapists are really good at modifying. So we might say, oh, that balance is not so great. Let's move all of those dishes down a notch so you're not reaching so high. But also, we work really well with physical therapy. So maybe that's a balance deficit that can be improved. So PT and OT work together. So we, at that time, would reach out to our physical therapy counterparts.
Right. So in addition to a physical assessment, do you do any assessments in regard to cognitive functions?
Mm-hmm. Yep. Most occupational therapists have a couple cognitive tests in their back pocket. I like to use the SLUMS test. It was originated here in St. Louis by St. Louis University, and it walks you through just a few quick tests for your memory, attention, verbal skills, and it gives you an idea of how your memory is in relation to other people your age.
Wow, that's cool. So then once you gather all that information, what do you do with it?
We use it to help find ways for clients to stay at home. All of these things go together. So if a person is doing rather well, but they've got a little bit of a memory problem, if you forget to take your medicines or get your medications confused and take them more than once, that's going to be a huge risk for a hospital readmission. So we say, okay, we need to work on medicine management, and we know that maybe your memory is not quite as good. So we look at setting up reminders or maybe moving where the medication's set. So we look at what we can do to accommodate for the memory impairment or the balance impairment.
Now, I know that oftentimes cost drives decisions, and folks often get concerned about out of pocket. Is it fair to say that your at least initial assessment and continual efforts are covered by insurance?
Most of the time they are covered by insurance, yes. Insurance is not perfect and Medicare is not perfect, so there may become a time where those services are not covered for various reasons, at which case that you can pay for them privately.
Great, but you'll let folks know, obviously, when it's going to get to that point before they enter into that.
Mm-hmm. Yeah.
Jenny, thank you very much. That's great information. I think this is an awesome place to pause and digest. Jenny, if someone wants to get a hold of you, ask you some questions, or check out your website, how do they do that?
You can reach my office at area code 314-742-0330. And my website is iots.health.
Okay, so it's iots.health or 314-742-0330. Once again, thank you for your time. And we're going to invite everybody to come back. We've got 2 more episodes to go with Jenny, so hopefully you'll come back. I want to thank you all again for listening to the Senior Learning Institute Educational Moment. At the Senior Learning Institute, we strive to provide the straightforward and unbiased information you need to make smart decisions the first time. Our goal is to connect older adults and their advocates to the resources they need, from aging in place, selling the home in any condition, estate and financial planning, in-home care, estate sales, clean-out services, you name it, anywhere in the U.S. without cost or obligation. To learn more, please visit us at theseniorlearninginstitute.com. So until next time, I'm Ted Gottlieb, certified senior advisor, seniors real estate specialist, and founder of the Senior Learning Institute.